Hey guys, my name is Nathan. I'm going to do a quick little talk about depression today. This is going to be a very simple video. It's not going to be glamorous by any means. This is like my second, YouTube video I've ever done, so kind of figuring it out. But yeah, I'm going to talk about depression. I'm going to talk about some statistics about depression. Kind of how it's treated, what I suggest would be a good intervention. I'm going to suggest CBT. That's a pretty well documented intervention. I'm going to throw in some research studies that back this up, and kind of a timeline for what I think would be an appropriate use of CBT, and then I'll provide some references at the bottom. So without further ado, so depression, it's one of the most common mental health disorders, and mental health disorders in general. According to a large-scale study co-led by Harvard Medical School and the University of Queensland, 1 in every 2 people in the world will develop a mental health disorder in their lifetime. Depression's kind of the big one that's common. I mean, everybody's known somebody that has depression, or many of us have been depressed, or known people in our family that have been depressed. So this is also backed up by the Healthy People 2030 initiatives, saying that basically like half of Americans will basically have a mental health diagnosis, at least sometime in their life. So CBT. Kind of the big intervention that you kind of see with depression, is pharmacological agents. Antidepressants, SSRIs are kind of the standard. But there's a lot of research that back these up in their efficacy. But a lot of times they, need other treatment modalities used in conjunction with them. CBT, as I mentioned before, is kind of a pretty well researched. There's lots of research that backs up the use of CBT. In this research that I looked at, CBT is kind of used in conjunction with a pharmacological agent, so kind of using both of those. But yeah, CBT, very common. It's used in many different psychiatric or mental health disorders. There's my dog, Hams. It's used to treat depression, anxiety disorder, somatoform disorder, and substance use disorder. So some of the research articles that I used that kind of backed up the use of CBT, Nakagawa did a randomized controlled trial assessing the effectiveness of adding CBT to pharmacotherapy in adults with treatment-resistant depression. The study demonstrated significant reductions in depressive symptoms with the combined treatment compared to just pharmacotherapy alone. So that's promising. That's just one RCT that showed that, but however, I found some research by Kikuchi et al. 2023. They did a pretty comprehensive meta-analysis, and they did show short-term benefits of CBT. Some of the long-term effectiveness was unclear. And then thirdly, I found a qualitative study presented by Lowe. This was kind of interesting. So the article by Lowe, so he pretty much found in conjunction to the Cherokee people, they did like a mission statement in 1976, and they said, I quote, "The mission of the government of the Cherokee Nation is to promote and sustain the self-reliance of its members. So, tying that in with kind of CBT, so a lot of mental health, which I don't think gets discussed about more than it should, is just the kind of the self kind of determination of mental health treatment for yourself. And so I thought this was really good, that like kind of puts the power back into the patient and back into the person, and really helps them kind of be kind of patient driven. But so I think, to tie this in with CBT, so kind of some main premises of CBT, 3 of them. Number 1, psychological problems are based in part on faulty or unhelpful ways of thinking. Number 2, psychological problems are based in part on learned patterns of unhelpful behavior. And 3, people suffering from psychological problems can learn better ways of coping with them, thereby relieving their symptoms, becoming more effective in their lives. So CBT, for those that aren't familiar, CBT is kind of like learning different ways to kind of think, and kind of like a metacognition, like thinking about your thinking, kind of becoming aware of kind of those stories that you tell yourself, your doubts and your negative self-talk. I mean, I call it stinking thinking. So that's really big. Just the attitude and kind of the story you kind of tell about yourself, and you kind of develop these behavioral patterns and ways of thinking that really can change your overall mental health and quality of your life. So CBT really seeks to address those things. I suggested, moving along, that in the clinic, kind of at least monthly, kind of going along with these research studies and kind of the data that they suggest of CBT being helpful, I kind of tied it in, at least once a month, CBT along with your pharmacological meds, like if you're on an antidepressant, that can be really helpful. And then I kind of put some outcome measures. I made a Gantt chart. I'm not sure how to share a screen with you guys. That would be a lot easier, but a lot more helpful. You could see it. But basically, CBT treatment monthly. Many of you have probably seen the PMQ-9 assessments when you go into the doctor's office. Are you feeling suicidal? How is your anxiety? How's your depression? I guess the anxiety is more, the GAD questionnaire, but kind of that depression questionnaire. I've seen those, like when I go to the doctor. Those are good. You could do those every month. I kind of put, every other month. And then there's also a thing called a HAMS questionnaire that could be really helpful as well. Yeah, I guess main point being, I'm trying to improve the mental health of my community. I'm a registered nurse. I've been working in psych for about 7 years, and I really want to help the mental health of my community. I live in Boise, Idaho, and that's just kind of my big goal. So hopefully this helps somebody. Hopefully it wasn't too dry and academic. Hope everybody has a great day. Please, if you need some mental health, please, reach out to family, or, go to your primary provider, and, seek that treatment, because I feel like the stigma as well with mental health needs to change, and it needs to be more welcoming in our culture for people to seek the mental health treatment. So I'll provide some references below. I really appreciate you guys' time. I hope you have a great day. Thank you.